In this video, you'll learn how to do 5 simple and effective exercises for relieving pain in the shoulder, arm, and the hand from a pinched nerve in the neck. These exercises can be done at home and they require no equipment whatsoever. The most common symptom of a pinched nerve in the neck, which is also called cervical radiculopathy, is numbness and tingling in the arm, hand, or fingers. You may have described it as, oh, my arm or hand feels like it's fallen asleep, feeling that need to really shake out the hands and arms. There can also be shooting pain into the shoulder and arm. And there can also be severe, intense neck pain with difficulty moving the neck. Some common causes of a pinched nerve in the neck are degenerative arthritis or degenerative disc disease, a cervical disc bulge like a C5, C6 disc bulge, or a C6, C7 disc bulge, spinal misalignment in the neck, bad neck posture, and a combination of any of these conditions. Now, because the pain from a pinched nerve in the neck can be extremely severe, it's essential to have an exercise regimen in place that can provide the necessary relief. That's exactly what this video will give you. Not only am I going to demonstrate these 5 pinched nerve relief exercises, but I'll also give you the number of repetitions, sets, frequency recommendations for each exercise. So be sure to watch right to the end of the video. You won't want to miss those parts. And there's some completely up-to-date, scientifically backed details in a few of the exercises that are fresh on my mind as well. Hi, I'm Dr. Joshua Gelber. I'm a chiropractor in the Annex area of Toronto, Ontario, Canada. We focus on helping people overcome headaches, dizziness, vertigo, neck, shoulder, and back issues through specific chiropractic spinal correction techniques. Before I dive in, smash that subscribe button if you want to enjoy a more comfortable and active life, who doesn't, with better posture, increased mobility, and free of chronic pain. Also, tell me in the comments below that you subscribed, and I will personally reply back to you. Now, the first 2 exercises will work on improving mobility and flexibility of the neck, relieving pressure on the nerves in the neck, and relieving the neck pain itself. Why is it important? Well, because by definition, the origin of this condition is in the neck. It's the cervical spine. That's why they're also called cervicogenic exercises. Disclaimer, before proceeding with these exercises, it's always important to note that while they're designed to improve neck mobility and reduce discomfort, they may cause some individuals to experience temporary distress or discomfort or nerve-related sensations. If you experience any pain, discomfort, or unusual sensations while performing these exercises, please stop immediately. Consult with your healthcare provider or ask me questions, as these exercises are not suitable for everyone, and modifications might be necessary based on individual health conditions or limitations. Always prioritize safety and listen to your body's signals during any physical activity, let alone these ones. So as you're about to do these exercises, step 1, mirror me on screen while you start to do them to give you an idea of what's going on. If possible, have a mirror nearby, literally a mirror, and watch yourself in the mirror to make sure that your movements are consistent with how I'm guiding. One of the big issues, people do these exercises at home, but they're not necessarily looking at how they're doing them. They might do them less effectively. So follow me, have a mirror, do both so that you're more effective with these and getting better results. Exercise number 1, neck range of motion. Main things this will do is going to help decrease neck pain, improve mobility, and relieve pressure on the pinched nerve. Your goal with this set is do it 3 times in each direction. You should repeat these daily, in the morning, after a work day, before bedtime. And I'll show you the tighter version of these, or the position you'll feel more resistance, completely natural. So we're simply going to start with rotating our head to the side. Holding for 2 seconds, 3 seconds if you'd like, back to center, and to the other side. Now you'll find as you start to do these, you might not be going as far as nose over shoulder. That's okay. Use your limit, stay within it, and gradually work to increase this. Back to the other side. Pausing in the center may help reduce any dizzy triggers or lightheadedness. To the other side. One more. And one more. Next, we're going to go into flexion and extension. You can start by going upwards. Now, those of you who may have more of a forward head posture might find this difficult. What you can try is to really bring yourself as upright as you can tolerate, and then see if it's easier. You can do 3 in a row in the up extending direction. You can also go extension into flexion, depending on, again, how stable you feel with this. Some of you might be inclined to tip your head to the side. With cervical radiculopathy, if there's degenerative change, there is a high chance that the micro small ligaments connecting the vertebra together have some tears. This side-to-side position could worsen things even if it feels straight. So I'll say try it at your own risk. If you start to do these and anything feels really aggravated, discontinue. If you're just gently going from side to side and it feels tolerable, good. The other movement is the figure 8, the infinity symbol, which engages the upper cervical, increases range of motion and mobility, and will prevent any other strain on those ligaments by just thinking about gliding your head through a figure 8 pattern. Nice and slow. Might feel weird. Check in the mirror to make sure you're doing it right. Like that. 3 times in each direction. Repeat them daily. Morning is best. After a tight, static work day, also great. Exercise number 2 is the neck stretch set. Similar to the range of motion, just a little further. This is going to help increase flexibility, decrease muscle tension acting on the spine, thereby relieving pressure on the pinched nerve and potentially relieving pain in the neck directly itself and the arm, hand, and fingers. Now this will actively have more release on musculature, stimulating vertebral joints to open slightly, stretch by stretch. Same as range of motion. The goal for this is 3 times in each direction. You can repeat this daily. Best done after the range of motion, which opens things up. This will open things further. And what we're not going to do in this special one is we're not going to pull our head from side to side. People will crave it, they'll want to do it, but as I mentioned before, if there is any micro tearing from degenerative changes down here around that radiculopathy source, you might aggravate things. So we're going to go through neck stretching, rotation position. I'd say use the side of your hand and just pushing that weight. You're going to turn your head further than in that active range of motion. Okay? Don't hurt your jaw doing this. Don't push hard enough that your jaw is uncomfortable. You can use your cheekbone, you can just use in front of your ear. Okay? And the goal is to see if you can push as far, if not slightly further, than the range of motion exercise. It's important to depress your shoulders, sit upright as well. Okay? Hold this for cut that part of hold this, I'll repeat it. You can hold these exercises for up to 20 seconds. If you feel really stiff and that a slow breathing based stretch makes you more relaxed, great. If you feel aggravated by this or it's new to you, 5 to 10 seconds is a good starting point as well. One more rotation. Now, to stretch your neck in the flexion direction, gently, hands on the back of the head, and you're just going to, again, let your head drop. And as if you're trying to depress your head towards the ground to look down further, keep your posture up for this also. It's key to not aggravating or stretching another area versus specifically the neck and upper back. You'll feel this in different areas: upper neck, middle, lower, even the upper mid-back between the shoulder blades. Any number of zones will feel stretched by this. That's okay. If anything feels, again, nerve-related, aggravated, stop. Also, up to 20 seconds, 5 to 10 seconds for beginners. In the extension direction, start with going up, and now just on the forehead. Just keeping the shoulders as down as you can, low as you can, depressed. Now, it's natural as you do those that you'll feel pull in the front. We sit here way too much. That pull, that tension, you're going to have muscles being cranky about this. So be gentle. Again, sit upright, tip your body, and just relax your jaw. If you need more of a break between the extension stretches, take it. Now, as mentioned in the neck range of motion, we are not going to pull from side to side. That's potentially going to cause aggravated tearing. If you're not sure if there's tearing, it's hard to confirm if there's tearing. It's best to avoid that unless you've had x-rays and you know that there isn't degenerative change going on. If you know you have not had a whiplash or a traumatic injury to your neck, a concussion, those can affect structural integrity. Those are good reasons not to stretch from side to side. If you're someone younger, typically, if you have not had any head and neck trauma ever, if you've seen an x-ray, again, that doesn't show degenerative changes, a gentle side to side stretch is acceptable. Ask questions in the comments if you're not sure or need a reminder of should I or should I not. Again, 20 seconds as a goal, 5 to 10 seconds for beginners is a pleasant start. There you have neck stretching. These next three can feel more delicate and sensitive as you perform them, so be cautious. Like the disclaimer, if you feel any intense pain or discomfort as you start, stop. Some relative awkwardness will occur, like a deep stretch, like a muscle that's been tight forever and is finally starting to release. Exercise number 3 is the radial nerve glide, also known as the radial nerve floss. Now, this will help relieve irritation of the radial nerve, relieving numbness and tingling in the thumb and the back side of the hand on the thumb side. This one's best to do 10 times daily after the range of motion and stretching. Whether you're standing or sitting, this is how it should go. So we're going to start. We're going to start with your hand into the flex position, putting it down, depressing our shoulder. We're going to have that shoulder depressed and set. And then start to tip your head to the side. Like the stretching position, but gently placed. And with your arm and hand still flexed, arm will extend. Now again, you'll feel a weird sensation as you do this. You want to start on the side of symptoms. You can work on the other side, but focus on the side where you have radiculopathy, numbing or tingling into that side. And you want to slowly go into this and come out of it. I would say count to 5 as you do it. So flex, 1, 2, 3, 4, 5, and relax. That's what you're going to repeat 10 times is 1, 2, 3, 4, 5. 1, 2, Exercise number 4, the median nerve glide, also known as the median nerve floss. This helps relieve irritation of the median nerve, relieving numbness and tingling in the second and third fingers. Same as the others, 10 times in a row daily after range of motion, after stretching. We're going to start with your arm in a flexed bicep-like position, the hand coming in like so. Starting to tip the head, similar to the radian nerve slide, tipping the head, but this is bringing your arm out and open and extending your palm in this manner. Like before, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. As you gradually go through this, you may bring your arm down and drop the arm lower as you go. Focusing again on the side of symptoms. That's 6. 8. 9. Last one. As you do these, be sure you're doing the same consistent position without rushing through. It's easy to lose your form in any exercise. When you rush it, you speed up, and it is simply not as effective. Number 5, the ulnar nerve glide or the ulnar nerve floss. Helps relieve irritation of the ulnar nerve. That'll relieve numbness and tingling in the 4th and 5th fingers and the back of the hand on the pinky side. Again, you should feel a stretch with this. Maybe it's in your elbow, maybe in your ring and pinky fingers. Just as with the previous exercise, only perform this with a comfortable range. We're going 10 times a 5-second repetition. This one seems entertaining to some degree, and looking at your coordination as I've practiced and gone through it more. So we get the OK symbol, and we're going to invert and go over our eye and bring our fingers down the chin this way and look through the ring. It's an interesting one, right? So again, a 5-second movement of tipping your hand over and setting up, sitting up straight while you set up and come back down. 1, 2, 3, 4, 5. That's 4. 6. 8. 9. 10. Now you have a set of 5 exercises with some of those specific updates to help relieve neck pain and arm pain associated with pinched nerve in the neck. Be sure to time how long these take so you can schedule enough time in your day to perform them consistently. I know I run out of time if I don't plan ahead with a busy life. Give them a try. Tell me how they worked for you. Tell me, which exercise did you like the best and which gave you the most relief? Was it the neck mobility exercise or was it the median nerve glide? Be sure to like and share the video. It really helps others find this one and also benefit from the same exercises. Remember to subscribe if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. And if you want to learn more about the cause of pinched nerve, cervical radiculopathy, and how chiropractic adjustments are used to treat a pinched nerve in the neck for permanent relief, I have the perfect video for you to watch next. Go watch this video right here.